YouTube and Instagram Live. Today I wanted to discuss something about heart remedies because there were a lot of queries on my Skype, on my WhatsApp, and people wanted to know something very peculiar about some remedies in relation to heart complaints. Uh, Welcome, Mira, and Barreto. Welcome. So people wanted to know more about the heart complaints, and that's why I've few of the remedies, very interesting chronic and polychronic remedies, which you can think of when there is symptoms in relation to heart complaints. Good afternoon, Dr. Meera, and thank you for whatever did for Nusrat, and she was very happy. So let's go ahead, and yeah, Dr. Tamanna, Dr. Khan. So first of all, one thing is very important in heart complaints. Don't always go, hello Dr. Weber, don't always go with only heart remedies. This is my humble request. People basically want only to know about the heart remedies. So we'll now bifurcate only heart related organ remedies and polychronic remedies with some symptoms related to heart. This is very important to understand. Otherwise, you land up in those remedies which are only related to heart complaints like lactodactylus, like carbovise, like amyl nitrate, like cratagus, and so on and so on. Now, one thing, the first remedy which I will take today in relation to heart, it is very important to understand a very interesting case of tachycardia visit in my clinic. And we took the history, we gave the remedy, the patient was better but still not responding to treatment. And one of the very important symptoms the patient told that sometimes the palpitation is so high, it is so much that it can be felt, it can be seen on my face. Now, this is a very interesting symptom, that the palpitation can be seen on the face so much so tachycardia, and he had a rhythm disturbance. So we prescribed remedies one or two, but did not work. And then while reading Mater Medica, as I always say, keep reading Mater Medica, we had a remedy known as muriatic acid. Now, muriatic acid we have never thought about in these complaints, but there is a very peculiar symptom in muriatic acid in relation to heart complaints, that is palpitation of heart is felt in the face. We gave that patient muriatic acid 200 and the patient responded very well to the remedy. So this is how we have to understand the case first and then prescribe, rather than just having those heart remedies especially. One remedy which have given me very good results in case this complaints is, normally what happens whenever the patient comes and tells us that heart feels as if in a vice, and the remedy which we think about immediately, everybody thinks about Cactus grandiflorus. But when the patient comes and tells you that डॉक्टर साहब मुझे ऐसा लग रहा है कि मेरा पूरा खून, बॉडी का पूरा खून ऐसे लग रहा है हार्ट में जाके जमा हो गया, बहुत भारीपन लग रहा है, as if all the blood is in the heart and the heart feels very heavy. I feel as if the heart will burst out. That's why, because of this heaviness, I cannot walk erect. I have to walk just bend down. And you must think about the remedy Lilium Tig. You just see the heartbeat of the patient and it is about 150 to 160 per minute, and then Lilium Tig is important. So rather than being that periodized observer about the remedies, think more when the patient is talking about. Try to interpret the patient's language in the language of either Mater Medica or Organon, whichever suits you. As you go, more symptom in relation to heart disease of Lilium tigrinum is fears being alone, insanity heart disease, fear that she is incurable, or fear of impending calamity or fear of impending disease. So much fear is there. Fear of heart disease. So when there is a fear of heart disease, lot of palpitation, the patient feels all the blood is in the heart. He feels the heart will burst. And that's why the patient has inability to walk erect. Do think about Lilium Tig. Welcome Dr. Rajesh, Dr. Ruhi is there, Dr. Gaurav, Dr. Singh. This is in relation to Lilium Tig. One remedy which you have to think about whenever you are treating case of heart disease is glonine. I'll take, if you have some questions, do keep asking, because if I'm in Mater Medica, I may exhaust the whole half an hour. Welcome Dr. Amit. Glonine is a very interesting remedy. Whenever you are thinking about glonine, it is a very interesting remedy for cerebral congestion, or there is an alternate congestion of heart and the head, or alternate congestion of the head and the heart. The patient comes and tell you, डॉक्टर साहब मुझे पूरा ऐसे दिमाग में सुन भर ऐसे ठोके सा मन लगता है, आई फील एज इफ पूरा ब्लड मेरे ब्रेन में चले गए. फिर कुछ दवाई खाता, आई ईट सम मेडिसिन एंड आई फील दिस इज ओके ना, एवरीथिंग इज गॉन इन दी हार्ट. So it keeps alternating. The congestion is alternating. That is a very, very interesting symptom of glonine. And because of this congestion in glonine, there is violent palpitation. And because of palpitation, there is throbbing of the carotid arteries. So this is the important symptom of glonine, which I have seen in my practice. Other remedies which you must think about, whenever the patient says, I feel my heart is weak, I have a clinic in Bombay. So there was a case where the patient's reports were normal, but the patient had a lot of palpitation, a lot of weakness in the heart, could not endure exertion, could not climb some distance. So when we saw that there was no complaints of the valves, there was no organic affections of the heart, but still the patient had symptoms. In this, you have to think about digitalis purpura, a remedy without valvular complications, or it is said when there is no organic affections of the heart. When there is no organic affections of the heart, that is digitalis purpura. A very interesting remedy for dropsy in Bright's disease, when the separation of urine and internal external spasm with fainting, again when there are organic affections of the heart. So this is without valvular complications and with fainting when there are organic affections of the heart. Digitalis purpura has given me very good results in this type of cases. And one remedy, if I'll tell you something. So before we go to the questions, just one remedy that I have got very good results, that is Collinsonia canadensis. Of course, Collinsonia, very, very interesting remedy for piles and these type of complaints. But the patient comes and tells you that my heart is now better, but after your treatment, the piles have come. So after heart complaints are relieved, old pile complaints reappear. Think about Collinsonia. Very, very interesting, a very, very important remedy, Collinsonia. I don't want to go into that remedy of Lactodactylus and Carboveg and Crataegus, Arjuna, Adonis vernalis. These are typical heart remedies. But as I always say to my students, to my fellow who have joined me, I always tell them, make sure that you basically know the remedies in accordance to the whole case, rather than just only prescribing for those related symptoms of the heart. That's why in homeopathy it is said it is basically it's a art and then a science. If you have heard my one lecture in the International Homeopathic Forum just 2 days back, I have told something I prescribe through different ways of prescribing, and that's why it was important for you to understand how are the different ways to prescribe. So one question, welcome Dr. Amit, Dr. Jyoti, Dr. Vaishnavi, Dr. Pandey, 9770, Vansh, Heart, Barwala, Gaurav. So glonine and belladonna. Make sure first to understand each remedy. Basically, if I'm talking about this heart complaints and head, so I'll differentiate that part only. So glonine, we have to basically first in relation to to head complaints, throbbing headache, both the remedies have. But in glonine, better from uncovering the head. Remember, a glonine patient, when he sleeps, he'll uncover the head. That is glonine. Second, glonine, the head is very heavy, but cannot lay on the pillow. The head is so heavy, the patient cannot lay the head on the pillow. Second, very, very important symptom. Third symptom you have to understand, in glonine, headache in place of menses. These three symptoms very, very important in glonine, in order, because both remedies are related to head complaints. We always think about this glonine belladonna first in relation to head complaints. That's why I want to differentiate in that areas first. Now, belladonna. In belladonna, make sure that these symptoms are present. Now we were talking something about heart complaints. I'll tell you about that also. But whenever there is headache from suppressed catarrhal flow, my dear friends, write down this symptom. Suppressed headache from suppressed catarrhal flow. The patient comes and tells you that I had a lot of sneezing, I had a lot of coryza, but I gave some remedy and that is better. But suddenly headache has started. Much throbbing headache. And we see it is suppression. It has gone from nose to head. So metastasis there, laboratory should be thought of. No. This is headache from suppressed catarrhal flow, and the most important remedy is belladonna. Second, there is a constant moaning in belladonna. Apart from the throbbing of the carotids, the redness of face, I am not dealing that because I know that you also know that. Third symptom. In belladonna, headache is worst on the right side when lying down. In belladonna, headache is worst on the right side while lying down. That is again a very, very important symptom of belladonna. And ill effects of cold and haircut. Now, haircut, I have not seen in my practice, but just by touch, just by jar, just by contact, if there is headache, think about belladonna. Okay. So Dr. Meera has one question. I had one case of 10 years old boy had a habit of doing chori. He had stolen books, pencils of his friends, his mother in worried but habits. Okay. So Dr. Meera, first of all, I would like to thank Dr. Meera. My daughter was in Pune for some competition, so she had offered her to stay in a place and she is very happy. So thank you, Dr. Meera. Don't take the rubric spoiled child. This is called as desire to steal. Okay, kleptomania. So when you see the rubric kleptomania, you will get this type of remedies, and surprisingly, the first remedy in kleptomania is also belladonna. Second, think about sulfur. Third, think about nux vomica. One very rare remedy is if there is history of convulsions in the family or history of epilepsy in near grandfather, grandmother, the third generation, do think about Artemisia vulgaris also. But belladonna, sulfur, nux vomica will help you in this case. Dr. Amulya, welcome. All elements from overstretching, pain in right hip, how to approach the case. Now, overstretching, Dr. Amit, a very, very interesting word. Overstretching is you're talking about in relation to mind or body. First, tell me that so that I can enter the case for you easily. Overstretching, mind or body. I told you a remedy, a patient overstretches his emotions, overstretches his mental body. Okay, so I'm not going to do that. Now, overstretching. Simple as that. When you stretch, you are basically using the muscles or telling the muscles to do more work. So whenever the patient says that because of lot of stretching, the symptoms have developed. Elements from overstretching, there may be some good remedies in a mater medica, but I'll just tell you what basically I think first when I have this type of remedies, complaints. First, think about calcarea carb. Second, think about thuja. Third, think about sulfur. And fourth, think about stephysagria. These are basically very important remedies where I have seen this type of cases. But when the patient says stretching ameliorates, in that case also calcarea carb is given. So then you have to see when, suppose if right hand is involved and stretching the right hand aggravates, means when stretching the affected part aggravates, then three remedies again very, very important, Dr. Amit. First is Rustox, second is sickle core, and third again is calcarea carb. See, calcium in relation to muscles, so calcarea will be there in all the complaints. So do think about these remedies. Next. Yes, I hope you understood something, Dr. Amit. Satisfied or I have to go further? Dr. Karthik Pal. Okay. So these are very, very important things. Next, we were talking about heart. So okay, fine. One thing I would like to tell you, Dr. Amit. We had a case, I had a case and the case taking was going on, And the patient in between case taking used to do like this, like this. He had a habit of stretching. He had a habit of stretching. And then after some time, I told my assistant, please take this rubric. There is impulse to stretch. There is impulse to stretch. And we gave that patient causticum. We entered the case through that and gave the remedy. So when there is impulse to stretch, the patient cannot, hold that impulse. Then you must think about causticum, naxomica, alumina. So see, whatever stretching I have told you, this involves the muscles and the content of the muscles. So potassium is there, that's why causticum is there, calcarea is there, calcium is there, naxomica on the muscles, so muscles is there, alumina again works on the muscle, it is there. So this is how your homeopathic mathematica should develop, and it is such a wonderful science, You enter the case through everything, but whatever you enter, everything should match the remedies. You go through what you call physiology, pathology approach, or symptomatic approach, theme approach, repertory approach, everything will end up in that remedy. This is the beauty of our homeopathy. So I hope everybody got something to know about this stretching. It is important to understand, because sometimes we tend to have no symptoms and then try to prescribe these type of remedies. If you have heard my, again I'm telling you that international heads conference, and I had put that on the YouTube also, on the link on the WhatsApp, and I told how to prescribe through seeing the forehead. It was well taken by the audience, and we had a lot of audience. Next, in relation to heart, not heart, the remedy which are important, polycrest with heart. Sometimes now sports have become very important, a good part in all school curriculum. And I had a very interesting case. The patient was basically doing that floor exercise, floor gymnastics, and after some time, he developed that breathlessness and dyspnea and palpitation. So it was basically done that the patient suffered from hypertrophy of the heart. And whenever just a minute, Dr. Vansh. Whenever basically, if there is hypertrophy of the heart, especially from gymnastics in growing students, boys or girls, do think about an interesting remedy, bromium. Bromium is a fantastic remedy. You will get few cases in your life, but make sure if you get one, do give bromium, and it is a very, very interesting symptom in case of bromium. Yes, Dr. Meera, thank you. I think you were there in that forehead experience, belladonna case. Yeah. So next, belladonna case was such an important case, my dear audience, and the doctors there were surprised that because they felt that belladonna was an acute remedy. So how could you cure the chronic complaints of the patient with a single dose of belladonna 200? And we had a lot of good audience, and everybody had it was an eye opener to a lot of doctors, and that's why I say in homeopathy the symptoms or the repeated language has to match in order to have a very good prescription. So one question is there. Yeah, thank you, Amit. How important is studying philosophy, and from which author to start? Philosophy is the basis of our homeopathy prescription, Dr. Vanch. And which book, there should be no confusion in this book. Normally when we studied Organ of Medicine, the aphorisms from B.K. Sarkar and Hahnemann's Chronic Diseases, do read Kent's lesser writings and Kent's philosophy. These are very, very, to start with these 4 books, these are very, very important. At one point of time, if you read Kent, it is simple to understand, and you'll have a lot of inputs in how to prescribe, what to see, how to enter the case. You'll have a lot of insight when you read this Kent's philosophy. So to start with, you can start with these 3-4 books, and you will be very surprised that up till now, if you have not read, you will be surprised how easy sometimes it becomes to prescribe. And of course, every doctor after a certain point of time develops his own habit to enter the case because of the experience he develops in practice, but the base is always the philosophy. Okay, Dr. Sharon, welcome. Good afternoon, Dr. Roy. A few questions, I think on Instagram have been scrolled up, because I was just giving the answers. So these are very, very important things. And of course, people always ask me, whenever I'm prescribing for heart complaints, and that's why in a Bombay seminar, I told that we are homeopathy specialists. we are homeopathy specialist and not organ specialist, not a thyroid specialist or not a fever specialist or a headache migraine specialist or psychiatry specialist. We are homeopathy specialist because our approach basically, if you read philosophy, as Dr. Vansh has rightly pointed out, we are a homeopathy specialist. And when the symptoms fall automatic, everything is put to order, whatever is in disorder. So be very happy and be very proud that you're a homeopath. But everybody wants one symptom, that is of crataegus. And in crataegus, the first symptom that you should look, I'm telling you symptoms. Huh? It is extreme dyspnea on least exertion. Extreme dyspnea on least exertion. And why there is dyspnea? Because the amount of blood reaching the heart through the coronary arteries cannot reach properly because of the blockage. And that's why there is increased what you call exertional dyspnea, or there is valve involvement. That's why it is said that crataegus has a crustaceous solvent power over the crustaceous and the calcareous deposits in the arteries. Make sure that you put this sentence in your head, as it is written in I think in Boric, that it acts on the muscles of the heart, and that's why it is a heart tonic. Okay, or in any disease, chronic disease of the heart with extreme weakness, crataegus is a very very important remedy, and there is a general NSRK in crataegus. Okay, so again, then there is aortic stenosis, aortic disease of the heart, and these are all other or the heart sustains in infectious disease, that is also crataegus. So these are 4 or 5 very important symptoms of crataegus. I'm telling you because everybody asks me something about crataegus, but this is the important symptom that I've seen in my practice. Okay, not to forget, and don't forget Lactodactylus mecanthus. If you see Lactodactylus, basically it has exactly same symptom as angina pectoris. There's a violent pericardial pain extending to the axilla and down to the arm and the forearm, in the fingers, with numbness in the extremities. That is Lactodactylus mecanthus. One symptom exactly of angina, you must think Lactodactylus with feeble pulse, feeble and rapid. So this is Lactodactylus mecanthus. And it is written in Matermedic that the precordial region seems to be the center of action of heart complaint of the remedy. This is Lactodactylus mecanthus. So I think sufficient telling you something about the heart remedies. Can we have few more questions? If I'm teaching Matermedic, I'll be keep on teaching that now. Any other questions? In I think Instagram, lot of questions have scrolled up. So if rubric kleptomania, I think I've done that. Sharon is there. Yeah. So this is, if there is no other, we can always go and think about some more remedies in relation to heart. But I would still like to first answer your questions. That's more important rather than going detail about Matermedic of heart remedies. Anybody with few questions? Yeah. So if there are no questions, we can always have some complaints in relation to heart remedies. One more remedy that you think about, of course, the very polygraph remedies always say sleeplessness with no fatigue. Very very interesting, very very interesting. When there is sleeplessness and there is no fatigue, now how is the patient? How is the place? If there is no fatigue with sleeplessness, there are 3-4 remedies which are very very important. The first remedy you should think about is which I think about is fluoric acid. There are some remedies where the patient says that I just have to take a wing, I get up. Just take a maybe half an hour power nap and I get up. So that can also have the same relationship with that. So first think about lacasis, fluoric acid. Second, think about lacasis. Again, a very very interesting remedy. And then there are other remedies, like we have Nux vomica, we have sulfur, we have causticum, we have phosphorus. But these 3-4 remedies very very important. Just sleeping for some time and the patient is absolutely fine. There is no what you call hangover, and there is no fatigue in that patient. I had a very interesting case just last week, and the patient had sleeplessness. I distinctly remember sleeplessness from dispute. there was a dispute in the house because of some property problem, and the patient says after that I have sleeplessness. Can anybody get me the remedy? What was the remedy? Sleeplessness from dispute. Anybody? Anybody? When there's dispute and there's sleeplessness. Okay, so you think about it, then I'll get with the remedy. Using mother tinctures in pathological cases, your opinion on this? Yeah, I used to use maybe few years back, but basically now I stick to that polycrestin acute prescribing. But sometimes what happens that the patient is far off and the patient is of blood pressure, and he says, Doctor, give me something. If my pressure increases, then what will I take? So for his security, for his support, I sometimes give Rolfia mother tincture. I give that. Or sometimes it happens that the patient says, no, I have some stone problem, so give me some remedy for pain. If the pain happens, what will I do? In that case, sometimes I give Berberus vulgaris, but I would not be able to comment more because my experience on using mother tincture is not so. I have not used so many mother tinctures in my practice, so I can't answer fully. Dr. Prachi, welcome. Stephis agree, yeah. Yeah, from dispute. It is Stephis agree, not Califos. Yes, Dr. Rohit Stephis agree. So these are now. See, you can always take sleeplessness in that case because of what you call problem in the family, elements from deception, elements from humiliation, mortification, also cause sleeplessness. That's why I always say interpretation is important. When there's a dispute in the family, the one brother is humiliated, or there's mortification, there's ego hurt. So remedies, a lot of remedies. But because I have told you specific, because of dispute, you got the remedies Stephis. Otherwise, you can have other remedies. You can have Nactimur, you can have you can have acid phos, you can have indigo, you can have staph, you can have lyco, you can have remedy related to ego hurt also. So your interpretation, as always, is so important in your practice and treating cases. Okay. One thing also in this type of cases you have to understand, just as somebody had asked me for sleep. Some patients come and tell us, Doctor, I just sleep in my evening OPD also for 15 minutes. I can practice till 1 o'clock in the night. So this is called as sleeps in short naps, or it is called as cat nap sleep. The most important remedy, you will be surprised, that is Rustox. That is Rustox. That is camphor, and that those remedies have given me so many good results. Apart from the other symptoms also of the patient. But the important thing is your interpretation. So yeah, phosphorus, califos, all remedies are for sleeplessness, but from dispute, that one word which has made the difference is phosphorus. Stephis agree. So this is again very important. Again, catnap sleep, you can think about phosphorus is also an interesting remedy for catnap sleep. In fact, calcarea carb, which is sore, fat, flat and flabby, but even catnap sleep in calcarea carb is very important symptom. So this is your interpretation of matrimony that you should think about. Very nicely answered, Dr. Sheikh. Stephis agree, Dr. Ransno Wagon. Okay. Yeah, I think you can write your names also. Yeah, acid phos is also there. Yes, but you have got from dispute steps like this there. So these basically are the experiences in relation to those questions about relation to sleep. Now, I think it's already half an hour, but still, I would like to complete something. If the patient says, that whenever I'm hurt, whenever I'm emotionally hurt, whenever there's emotional trauma, I get a lot of palpitation. So don't take that symptom elements from dispute, from deception, from anxiety, from anticipation, and go to other remedies. If your interpretation is not good, you will not be able to get the required remedy. If you give the interpretation elements from emotional trauma and other remedies, calcarea ars will never come. Because calcarea ars has a very, very important symptom. Slightest emotion causes palpitation of the heart. So if the patient says I'm preparing for an exam, there is a lot of anxiety and palpitation, or it is only a symptom related to that event, then you can take anxiety, but it's a basic symptom of the patient. Whenever there's emotional trauma, the patient has palpitation, do think about calcarea ars, calcarea arsenicum. Yes, acid phos is there in catnap sleep. Good. So these are symptom in relation to what you call heart complaints. Of course, there are other remedies, other things also, but I would just like to share. That's why I wanted to share some remedies, where it is not only the heart involved, it is basically the whole constitution involved. And then, okay, so I hope everybody has got something in relation to heart complaints. I tried to tell you few remedies because there were so many questions on WhatsApp and my Skype, so that's why I had to take something about heart disease. But be proud that you are a homeopathy specialist and not an organ specialist. Okay, that's why the whole case is important. Of course, if you get a syphilitic symptom of local part also, that also becomes important, but the whole case is very important. So my dear friends, thank you for joining, and meet you again next time in one of the webinars which I do normally. One or two webinars I do weekly, so do join me in there. Otherwise, my YouTube channel or Instagram channel is always live on every Saturday at 3 o'clock. So thank you for joining.